So today we're going to be showing you how to do ultrasound for increasing tissue extensibility of the right upper trapezius muscle. And the goal for this would be to increase the tissue temperature in order to get those thermal effects through the continuous ultrasound. And by doing that, you're going to, like I said, increase the extensibility and the stretching ability of the muscle. There are a few contraindications we need to be aware of. Some of the major ones include if the patient has a malignant tumor currently, or if they have had a history of a tumor in the past 5 years, you're going to want to clear that with the physician. Also, if the patient is pregnant, we don't want to do this ultrasound in an area where it's going to be able to reach the fetus. Same with the pacemaker, so don't do it in an area where the waves are going to get to the pacemaker and potentially alter its conduction. And then also with a contraindication would be if the patient happens to have any cement or plastic implants, we don't want to do it right over those. A few precautions to be aware of are if the patient is in the inflammatory phase of healing, we don't want to do ultrasound over that area because that would make the inflammation possibly worse. Also with children, we don't want to do it over the epiphyseal plates, or if there's a fracture, we also don't want to do it over there. And also, if the patient has impaired circulation or skin sensation or anything like that, we want to be aware of that. Before we get started, we should make sure that the patient has intact sensation, like I said, and we want to just observe the skin and make sure they're able to communicate the things that they're feeling. So after we've cleared the patient for any contraindications and been aware of the precautions, that we've checked the skin sensation and just made sure that the area is okay for treatment, we can start to get started with the treatment. So on the machine, I will have it set at 3 megahertz for the frequency, just because the upper trapezius is a fairly superficial muscle, so that would be the appropriate frequency setting. The intensity would be fairly low at about a 0.8 watts per centimeter squared intensity. And then since we are going for the increase in tissue temperature rise, we're going to go with the 100% continuous duty cycle to get those thermal effects. And then before we get started, we have to make sure that we clean the ultrasound head with an alcohol swab, just to prevent infection from spreading or anything like that. And then we will use gel for the medium, so you're going to apply gel both to the area of the patient as well as the ultrasound head. Okay, so based on the ERA of the sound head and the treatment area that we are going to be applying it to, the treatment time will be a total of 8 minutes. And whenever you do start to apply the ultrasound head, you have to, this is very important to remember, to at all times keep it moving to prevent those standing waves and any burns from occurring to the patient. And another thing to remember is that once you go to turn on the machine, make sure that you're already in contact with the patient and moving it to prevent the crystals that are inside the head from kind of exploding and then ruining your ultrasound head. So again, after I've applied the gel to the head and the patient, we can go ahead and get started. So Rachel, as I'm doing this, you should feel some warmth, but you should not feel it burning, and let me know if you do feel it burning, because then I can adjust it as needed. Okay. And as you can see, I'm having her kind of flex forward a little, side bend a little bit, and then turn towards the right. And that's just going to help promote the extensibility during the treatment. So then, you can go ahead and stop. So after the 8 minutes has gone by, you can go ahead and wipe the patient off with a towel, and just making sure that she has responded okay to the treatment and that there's no burns or anything wrong with the skin at that point. And then again, just make sure to clean the ultrasound head with an alcohol swab at the end. And that's it for this treatment. And then other things that could be used to increase the tissue extensibility would be something like shortwave diathermy continuous, to the same area or even a superficial hot pack.